One of the main aspects of miniature implants is the simplicity and straightforward process that you get with these implants. The fact that bone drilling is minimal, or in most of the cases you don't even need to bone drill, allows you to place your implant using a guided surgery technique to have more accuracy in implant placement. And that's what we did today. In this case that you saw, the bone is already atrophic, patient been with dentures for a few years, and in the upper left side, the alveolar bone is about 4 millimeters or less. But even with that situation, with guided surgery, I managed to place a few implants in there without raising a flap, without doing bone grafting or augmentation, and transition the patient from a removable denture situation to a fixed prosthesis. I took scans with the gauges, iOS gauges in place, and the lab will receive all of those information and starts doing the smile design and providing the provisionals, or in this case most likely will go to the final restoration because we already have a good primary stability, not drilling the bone, not raising flap. It allows us to straight away go to the final prosthesis. So the lab will design the teeth, and we have a mock-up for try-in, and after that, that will go to the final finish, and final fixed prosthesis will be provided to the patient. So it's revolutionized the way that we do implant. Miniature implants allow you to transition your denture patient straight to a fixed restoration with a very minimal and unbelievably simple process. Guided surgery definitely has a role in there to provide you more pre-planned treatment and knowing where your implants are going. Even with very narrow ridges, your implant can go right into the middle of the alveolar bone, and you don't even need to augment the bone or graft the bone. And that was an example of that. I just wanted to show you that, how simple and how easy that process is, rather than going through extensive surgery, raising flap, grafting and augmenting the bone, and waiting months for healing, and then go back and drill the vital bone, hoping to place few implants in there, knowing that in future with such a traumatic approach, you will have some bone loss, some marginal bone loss, and you will have a good potential for pre-implantitis. With this system, you don't get any of that because the implants are gone in the bone without much bone drilling, in a very nice, simple way, without raising the flap, without exposing the bone, without having any chance of leakage or macro leakage between implant components, and you have a very stable outcome. A lot of flexibility comes with that system, allows you to place your implant as deep as you want, as high as you want, and even with guided surgery, that sometimes we make mistakes, sometimes it's not predicted as the way that we want it. You can easily maneuver around it and change your plan with miniature implants because you don't have that damage to the bone, you don't have that drilling socket in the bone, so you can easily amend your way, you can easily change your implant placement, direction or position, and that can be done quite simply at the same time without taking too much time or doing any major surgery. While with standard implant, you already drilled the bone, you already had damage to the bone, you cannot change your plan as easy as you expect. Sometimes your planning doesn't go ahead, you have to graft the bone, wait another few months to amend the situation. That is completely possible with miniature implants. Hope you enjoyed the video. We try to post our pictures showing how the prosthesis is gone in, the scanning process, and hopefully that will change the way that you look at dental implantology and change your way in treating your patients.